My name is Emily Griffey. I'm the Chief Policy Officer at Voices, and I'm going to go through a presentation that was given to the Senate Finance and Appropriations Committee on January 31st. I hope you can follow along. The committee is recorded, but it does not include the slides and the audio at the same time, so have an opportunity to re-record here. The Senate committee was introduced to Voices. Many of you are familiar with Voices, and we are here today to cover multiple issues facing kids that take an approach that looks at the whole child and how the systems interact with raising and supporting healthy children in Virginia. Voices specializes in family economic security, early childhood education, child welfare, mental health and wellness. We are keenly interested in identifying policy solutions that address the needs of the most vulnerable children. Right now, we are very concerned about children in Virginia and how we move forward, both with more equitable opportunities to addressing the pressing needs presented by the pandemic. Your job is to make sure that the finances work on the money committee. But we also know that behind the numbers are real lives. Babies getting a healthy start, kindergartners physically ready for school, high school students navigating the disruption of the pandemic. Today, we have some recommendations focused on economic security, behavioral health, and wellness. I'm starting today with economic security because family income often holds the key to a child's daily stability, including their physical and emotional health. Children are greatly impacted by material hardships, a lack of food, of housing, or of healthcare. Economic instability can lead to mental health challenges for parents as well. A caregiver's emotional health can have an impact on children, especially babies, as they grow and develop. There are two stories about family economic security that I want to share today. The first is prior to the pandemic. Black, brown, and rural families across Virginia were more likely to experience higher rates of economic insecurity. Historically high levels of economic disadvantage in these communities have led to generations growing up with stress and instability. For policymakers, that means that Black families in Virginia are disproportionately likely to receive public assistance, and you determine the rules for who receives assistance from SNAP and TANF and Medicaid. This chart here from our Kids Count Data Center shows the persistent rate of childhood poverty in Virginia over the last several decades and the disparity in that rate by race. The last point is child poverty rate in 2019, prior to the pandemic. The second story of economic security is more around emotional and economic security. Family stress has gone off the charts with worries about employment, income, families getting sick, and keeping kids safe. For nearly 2 years, parental stress has been high, and over the last month, with the Omicron variant and more kids getting sick, it has continued to climb. This study right here is from the University of Oregon and their Rapid EC study that surveyed caregivers across the country. So what solutions should we look for to address economic stability? Number one is to improve access to childcare. Childcare helps families work, but childcare can often be so expensive that it may not make sense to work, particularly if a family is caring for more than one child. 1 year of infant care is more than college tuition. During the last General Assembly session, you all improved child care eligibility by raising the income limits for families with children under 5 and allowing for eligibility during job search. The proposed budget would keep most of that in place. And an additional amendment from Senator Favola extends the income eligibility while increased federal funds are available. Since April 2021, around 5,000 children have enrolled under the new criteria, and over 27,000 are receiving financial assistance. Additional federal funds have provided more resources, which should make this possible without using general funds. The second solution is to improve access to public assistance. One thing that I wanted to note here is that while our traditional poverty measure that I shared before does not take into account what families receive in terms of government assistance and transfers, there is an alternative poverty measure that becomes the supplemental poverty measure, and that becomes very useful in understanding the impact that additional financial assistance can have on economic security. This estimate shown here from Columbia University demonstrates how additional income support has helped to buffer the economic uncertainty of the pandemic. Particularly helpful for families has been the monthly child tax credit payments, but those just ended in December. While parents will get the balance of their payments when they file their taxes in the spring, the future beyond that is quite uncertain as inflation continues and variants swirl. State actions can help smooth out the course and provide stability in two ways. The first is to continue the standard of assistance for TANF. You have raised the eligibility levels in the past, but it is still incredibly low for families to achieve that receive that cash assistance from TANF. The General Assembly has set a goal to raise that standard up to 50% of poverty. Senator McClellan has a budget amendment that would increase that standard of assistance by 10% this year. And a huge item of consideration for the General Assembly this year will be about what to do with tax credits and refunds. And there are multiple options on the table. We are prioritizing the refundable earned income tax credit that is in the proposed budget and carried by Senators Barker and McPike, because it will impact low-income families the most. Approximately 72% of those who file for the earned income tax credits have children in their households. The second is to consider the one-time assistance payments that have been proposed. These could provide some immediate relief for families in the current calendar year. However, the proposals are currently focused on householders and whether they are single householders or married coupled householders. We know a single householder could still have children in their household, or married couples could not. So I urge you to consider household size in these measures and consider targeting the income payments based on family size or number of dependents. The second area after economic security that we want to bring your attention to is around mental health and behavioral health. Like economic issues, we know the issues here have lingered long before the pandemic, and we are now faced with a growing problem on top of already shaky ground. This data from the Virginia Youth Survey in 2019 saw the mental health concerns of high school students and their feelings of depression and anxiety growing. This was particularly true among girls and LGBTQ students before the pandemic. With the pandemic, our young people have experienced a collective trauma, a shared experience of disruption, grief, and loss. Some may have lost loved ones, some may have experienced their own health scares. This has led to behavior concerns in schools, long wait times to see providers, and sadly, a sharp increase of children seeking help in the emergency room for their mental health needs. For the Money Committee, I offer this closer look at what you've spent on children's mental health services in Virginia. Our mental health system is complex and also includes developmental services like Part C, early intervention here. It also includes funding out of the Department of Behavioral Health and Development, as well as what's known as grants to localities, which is the community services boards. Out of these budgets for our mental health system in Virginia, we dedicate a small portion, less than 10%, to providing services for kids. And sometimes when new initiatives roll out, as was in the case of the rollout of alternative transportation, kids are often stuck waiting for the second phase of implementation. I believe it's time for a bigger share of the pie to go to children's mental and behavioral health. So what solutions have been proposed to address children's behavioral health? First is to look at integrating mental health into schools. While your investments over the last few years have done a great job to bring more school counselors and support staff into schools, they are working very hard and still overwhelmed. Their jobs are to help students on a path towards graduation and address some universal emotional and behavioral issues. But when it comes to diagnosing children with a mental health issue, creating a treatment plan, or providing treatment, they are not the most appropriate professionals, and families must turn elsewhere outside of schools. Often, those clinical professionals have long wait lists or can be inaccessible due to not taking insurance or out of the transportation area for the family. To ensure that students have connections to the type of provider who can diagnose and treat any mental health condition or behavioral health condition, as well as opportunities to provide clinical interventions in schools, Senator McClellan is carrying an amendment to create a $10 million per year grant fund at DBHDS for schools divisions to seek resources to pay for clinical services and partnerships with community-based providers. In addition to this integration pilot, we would like to see a work group meet to identify strategies to pay for more mental health services in schools, like pulling down Medicaid funding through the free care rule or the student's own coverage. They also need to address issues like the future of therapeutic day treatment, TDT, in schools. We would like to see school personnel and students be at those tables to help identify those solutions. Second area of solutions is around investments in the entire mental health system. While there is a lot of options on the table for our lawmakers to consider around mental health investments, we are lifting up increasing the Medicaid reimbursement rates as critical to meeting the needs of the most vulnerable kids. When we make these big investments into the future, we can ensure that the mental health workforce stays in place and that providers will accept Medicaid and will ensure children who have that and will serve children who have Medicaid coverage. The last area that I want to bring to your attention is really at the intersection of economic security and mental health, and that is being sure that we can cover all kids with health insurance in our state. Virginia actually ranks fairly low in terms of the number of uninsured children in our state. We are at 25, while we rank much higher in most health indicators. And part of that is because we have a number of immigrant children who do not receive health insurance in our state. A bill from Senator McClellan, SB 484, proposes to create a state-funded health insurance option for our immigrant children in the state. This would allow us to simply cover all kids and make sure that everyone has access to health insurance. 10 states have already chosen this path, and we believe it is time for Virginia to take this path as well. Now, as another area that is important is around language access, and all children need to ensure that they have access to services in our state government, regardless of whatever language they speak. Spanish, Mandarin, American Sign Language. There is a proposal from Senator Hashmi to create a work group to look at more how each state agency can integrate interpretation and translation services to ensure and reach a number of limited English speaking children and families in our state. Finally, raising up the other initiatives that are an important part of our policy agenda in Virginia. These areas fall in each of these agencies: social services around kinship care, the DBHDS around additional support for our VMAC program, our Medicaid agency DMAS will look at behavioral health, Medicaid rates, our health agency directs loan repayment programs and home visiting, and workforce initiatives across different agencies. We hope that these will also be a priority to ensure that children receive full and fair access and can meet their economic security needs as well as their mental health needs in the state. We think this moment is important to meet. Children are at risk, children are not okay, And if our budget does not prioritize children in a significant way, we will fail to meet this moment. Thank you for listening today.